Hi everybody, my name's Jane South. I'm a Professor of Healthy Communities at the Institute of Health and Wellbeing at Leeds Beckett University. But I'm here today with my Public Health England hat on because I'm the National Advisor on Healthy Communities for Public Health England. And Public Health England has had a long collaboration with Bromley by Bow, particularly supporting the development of methods to gather evidence on what we call community-centred approaches. So those are the sort of approaches which Bromley by Bow exemplifies, where communities' needs, assets and aspirations are really the starting point and the goal of the approaches that are used. So today, our webinar is going to be another fascinating webinar from Bromley by Bow on the measurement and evaluation of community-driven sort of outcomes framework. And our particular aim today is to provide practitioners and organisations who are doing similar work to Bromley by Bow with some insight into how to develop a community-driven outcomes framework, the sort of methods that can be used, and also the sort of development process. And this is very much a sort of practical session. So we're going to hear from people who've been involved in Bromley by Bow in developing this, in testing it in their services and some of their lessons learnt. And then there's going to be a series of breakout rooms in which people are going to come into sort of small groups to discuss some of the lessons learned and the tips from that. So hopefully from this webinar, you'll get a lot of really practical insight into how to take this forward in whatever context that you're working in. So just before we go on to hear from the speakers, and we've got a fantastic lineup, I just wanted to sort of say a little bit about measurement, because I've been, as a researcher, I'm on that angle of things, I've been working around the measurement and evaluation of community-centred approaches in the health and wellbeing field for quite a long time now. And this question of, can we get the right sort of evidence to demonstrate what we're doing, is really a major, major challenge, because we all know how these kind of approaches work on the ground and the importance of them to communities and to individuals. But sometimes just getting that research right has been difficult. So as we go through the session, I sort of pose these couple of questions really, is just perhaps think, can we achieve a balanced approach? Because we want often to be able to capture what's happening, how it's happening, and the people it's happening with. And we know that often research isn't very good at doing that when it comes to community services. It's much easier when we're in clinical services. So does it capture what's happening? Can we, the evidence that we collect, is it credible? Does it convince other people, funders, commissioners, and so on, external stakeholders, that we're doing the right thing? And finally, the most important thing, measuring what matters for communities. And for me, that's been something that's been a defining question about how to achieve that in my career as a researcher. And I really think that Bromley by Bow have shown a great deal of leadership in this, because they put investment of their sort of time, energy, sort of funding and so on, to be able to tackle that question and to try and shift where research often starts, which is not in communities, to where it really matters for communities. And I think that is the sort of question you might think about going through, is, you know, how can I take some of those sort of principles into my service or organisation or research practice? So enough from me, really. We're going to have a series of sort of presentations now, and I'm going to hand over first to Rob Trimble and some of the leadership of Bromley by Bow to talk about the outcome measurement context at Bromley by Bow. So over to you, Rob.
Thank you. Sorry, first technical hitch, everyone. Seem not to be able to unmute myself. Good morning. Really nice to see you all. Thanks very much for coming. Yes, I'm Rob Trimble, so I'm the Chief Executive of the Bromley by Bow Centre, and I'm also a partner in the Bromley by Bow Health Partnership. I'm just going to say a few things by way of introduction and kind of scene setting, and some high-level things around the aims of our Evidence into Practice project. And then Emma's going to talk in a bit more detail about some of the underlying purposes that lie behind why we're doing this particular work. So it all goes back really to, or this phase of our work goes back to about 2016 when we launched our Unleashing Healthy Communities research program. It was a 2-year program, lasted into 2018 and was extended into 2019, principally sponsored by Public Health England. And it's out of that work that this Evidence into Practice project has developed. I should say to begin with that this was quite a big and challenging task that we undertook. In fact, I suspect like many organisations of our shape and size back in 2016, there was a sense of what are we taking on here? What are we opening ourselves up to? As always, in this kind of arena, things not always as well resourced as we'd like them to. But I'm really conscious that over the years it's become increasingly obvious that this was the right thing to do. And I suppose to start with, there's a kind of a bit of advice to any of you who are in a similar position about wondering about evidence and wondering about community research and measuring what matters to communities. And the first step for me is to start. The second step is to start where you are. And the third step is to start where you are and keep going. I think along the way, there's many occasions over the last 5 years or so when we could easily have been diverted and we wouldn't have reached this position that we're in just now with the Evidence into Practice project. So I would encourage you, particularly if you're in the shallows of this stuff, to really persevere and start where you are and keep going. There are 3 high-level aims for me that lie behind this research and evaluation work we do. Pretty simple: improve, lever, and influence. By improve, this is about continual improvement. This is about how do we examine what we do, be self-critical, but critically, not just look backwards, but look forwards. Think about how we can do what we do better, how we can increase the range of services that we offer, and how we can be more effective within our community. And that, for me, is the primary objective of this project. The second element is to try and lever resources. Is really, for my mind, no point in knowing how to do things and know how to do things better if actually we can't lever the resources we need in order to deliver those services and develop those programs. And building an evidence base is good in and of itself, but of course it's also really important that we use that evidence in order to try and lever resources towards our sector and some of the community, now more than ever actually, towards our community sector. And then the third element is about influencing, and this is about sharing the model, sharing from both our successes and also our failures, the things that have gone well and the things that have not gone so well. In part to try and influence policy, but also in part to try and be a source of encouragement to other organisations who are sharing in our work and who've got similar programmes to ours, but also perhaps facing similar challenges. And finally, in influencing, for me, this is about making visible the work that's happening within our communities. There's so much stuff happening across the country, I'm sure represented by this group of people who've gathered just now. And so much of it is unheralded and unseen. And so part of this process of doing the research and evaluating our model is also about making it present and making it available to others as well. So those are the 3 things that I think lie at the heart of this project: improve, lever, and influence. And with that, I'm going to hand over to Emma.
Thanks, Rob. Yes, and hello, everyone. Good afternoon. My name's Emma Owen-Madison, and I work for the Bromley by Bow Health Partnership, which is sort of the GP side of the Bromley by Bow Centre. So it's a pleasure to be here with everyone today. I'm the Assistant Director for Population Health. So I've been working alongside the Centre for a long time and primarily on this Evidence into Practice programme and sort of the outcomes framework work. And I suppose maybe adding to what's been already said is kind of coming at it from a primary care point of view as well. I think this idea about measuring what matters is particularly important to us. So we're very good at measuring the biomedical, and actually what matters to communities is things like connections, things like aspirations, things like what it feels like to be a part of the community. And these are things that are seldom measured and seldom kind of reflected upon in primary care. So I think this idea, and it's been mentioned a few times, and I'm sure it will continue to be a theme throughout this morning, but actually measuring what matters, and not only measuring it, but understanding what matters as well, and kind of defining and developing ways of listening to communities to really get to the heart of what matters to them is a crucial part of this work. I think the other thing that's important to say is about the outcomes framework is creating something that is reflective of the kind of work that we do and the kind of relationships that we have. So in primary care and also in the community, actually our relationships are not short, they're not episodic, they're actually over a long period of time, and they span many different phases of people's lives. They have many different dynamics, they have many different contexts. So I think it's really important to also have an outcomes framework and methodology that really reflects that as well, and not just measuring change in and at the end of projects, but actually over time as well, so that we can start to see the difference that we're making as anchor organizations in the community as well. And I think finally for me, the last thing to add is about changing the profile of the information that we ask people about. So this has been really kind of brought to the fore in the last year or so with the pandemic, but actually even before that, fundamentally, we as organizations believe that health is made up of not just the physical, but the social, the biomedical, all of it. And actually our tendency is to measure the biomedical, but actually we need to change that so that when we build and create interventions, actually they're based on all of these things that we know are important to communities. And we have that information routinely collected and available and kind of part of our offer to patients as well as and local people and communities as to how we kind of design those health and support pathways. So with that, I will hand back over to Jane, I believe, and yeah, look forward to having some interesting discussions in the breakout rooms as well.
Hi, thank you very much, Emma and Rob. Is Catherine going to speak now or no?
Yes, Catherine Torrington.
Hi, Catherine, if you'd like to speak now.
Thank you. I wasn't being allowed to unmute. Sorry about that.
Never mind.
I'm Catherine Tollington, Executive Director at the Bromley Bibo Centre, and like Emma, it's great to be here. I'm also going to be asked Adam Lang to come on camera as well, because he's going to talk a little bit as well about our funding arrangements. So thank you to Rob and Emma for talking through our sort of ambitions for the outcome measurement and some of the possibilities. But in addition, and sort of unsurprisingly, we need to continuously demonstrate the value of what we do to our stakeholders and our funders in a way that seems credible. And key to that is being able to tell the story, but in a way that I've heard described as sort of balancing the passion and the proof. We can all tell the story about what we do, but actually we need to try and pin that down and create some solid facts and a robust approach to demonstrating what we do. And amongst our grant givers and commissioners, the sort of expectation of proof of outcomes is pretty high. But having those outcomes co-designed and tested with the community is of the greatest value. And I think that's what we're doing here. And of course, this incredibly important work has to be properly funded in order to do it well, for it to be robust, for us to be able to continue to do it, and also importantly share what we've learned through these kind of events. So alongside all the work that our practitioners are doing, we've been thinking about how we can fund that work. And Adam's going to briefly talk through some of the options. So Adam, are you there?
Hi everyone, it's good to be with you this afternoon. I'm Adam Lang. I work in our development team, looking after some of our funding opportunities. And I think one of the things we're often asked to kind of contribute to in terms of this space is kind of, you know, how can we kind of support others? And I just wanted to kind of run through very briefly how we've managed to fund some of this work over the past kind of 2 or 3 years, and the quite kind of multifaceted way that we've done that. And I think it's a mixture of kind of strategic funding, which we're very grateful for, but also, I guess, quite opportunistic funding, where we've managed to kind of join it up with other work and other projects. So I think, you know, as has been mentioned, Unleashing Healthy Communities was supported mostly by Public Health England through a kind of direct grant specifically to support the development of the outcomes framework, as Jane outlined in the beginning. That funding was also supported by Health Foundation, Wellcome Trust, and a corporate that we have a strong relationship with as well. And I think Health Foundation have also been continuing to support this work, as has been mentioned, through a strand of work around putting evidence into practice. And I think one of the key kind of strengths of the Bromley Bobo Centre is the fact that we sort of straddle this kind of research space with also being able to kind of use that to inform and improve our direct service delivery. So the two kind of feed off each other, and I think we're able to kind of contribute to a space where I think traditionally researchers kind of working in a more kind of academic background, I guess, need those sorts of partnerships, and I think we're able to offer that to them. I think also one of the things that's quite interesting about Unleashing Healthy Communities was the fact that the majority of the funding was for embedded academic researchers to kind of work with us. So that they weren't just kind of funding us, it was about embedding qualified, experienced researchers with us. And I think that really helped to kind of show the authority of the piece of work, and also the kind of research independence of it as well, which I think helped bring in funders and kind of support the whole project. I think secondly, that there's also, in addition to that kind of direct project funding, that there's we also try to add in a certain kind of proportion of our funding across our service delivery projects to support evaluation and our outcomes framework. And I think that there's a bit of a shift going on with us at the moment. In the past, we've been doing that, I guess, quite independently. So across a fairly large number of projects that we deliver. In the past, before we had this outcomes framework, there was a tendency to kind of evaluate those projects a bit independently of each other. And as kind of Emma touched upon, we're more and more now able to kind of join up the journeys across those projects and see how we support our community as a whole. And so what we're trying to do is, across those kind of numerous projects, have the evaluation support and contribute to the outcomes framework development and our kind of wider evaluation work. And I think that's again one of our kind of key strengths. Thirdly, one of the features of this piece of work as well was our kind of community research. So I think because we've got such close relationships with our local community, we're able to work with people in our community, train and develop them as community researchers, and use that to kind of, again, sort of straddle some of the overlap between local communities and the research space, tapping in a little bit to the kind of growing public participation agenda in research, and working with academic partners to support that. And it also, helps us to really gain quite deep insights into what's going on in our local community, and again use that to inform and develop our services. And then just finally, the team that works on all of this work around our outcomes framework also has a kind of small but growing commercial income. And for example, we deliver some social prescribing link worker training across the nation, I guess, and yeah, we're looking to grow that, and that work also, as part of that training, it also includes how to tap into knowledge sources around what's going on in other local communities, such as outcomes frameworks, and use that to design and deliver those sorts of services. Thanks very much. I'll hand back over to Jane now, I think. Thank you.
Thank you very much, Adam and Catherine. That was really helpful, again, context. And it's really, we don't often discuss the funding and about how we actually make these type of projects happen. So that was really useful, Adam, and I learned some things that I didn't know before, but I think it is useful for people about how we leverage in funding and support to try and make these changes. So I'm now going to hand over to Catherine Godward, who's been the sort of lead for this outcomes project, and Catherine's going to take everybody through the detail around the quantitative approach to outcome measurement in the way in which it's been done. I think, picking up on Catherine's point, reconciling the sort of the passion and the proof. So Catherine, over to you.
Thanks, Jane, and also to colleagues for setting the context for this piece of work. Before I continue, though, just to say that I think Berenice has posted in the chat an opportunity to ask questions as we go through this webinar, and also the breakout rooms, using the software Slido. And also contained within there are a couple of questions that we'd like attendees to answer before they leave the webinar today. So please do visit that link. So I'm going to provide a brief run through of the Bromley by Bow approach to outcome measurement, the steps we've taken to get there, some of which have already been mentioned or alluded to, and also colleagues will talk about in more detail in the breakout rooms, and also some next steps that we are starting to take or that we'd like to take. So the scope so far for the piece of work that we're doing includes community and non-clinical health services, and the plan is to extend to clinical services eventually. We're lucky at Bromley by Bow because everything's under one roof. We're embedding one approach that cuts across all programmes and clients similarly, rather than starting afresh for each project with the intention of using resources more efficiently. But this also allows us, the consistent data capture also allows us across Bromley by Bow more opportunity from the data that we capture, so we can cut it in different ways. We can measure change across all Bromley by Bow together for different programme delivery types, for particular cohorts of clients, etc. So the Bromley by Bow Outcomes Framework is a result of Bromley by Bow's Unleashing Healthy Communities research, which ran over 2 years, which has already been mentioned. And it included a consultation, a very wide consultation with members of the community to identify the ingredients of a good life from community members' perspectives set within a current and historical context. And the community in this case means residents, practitioners and staff. A range of creative community engagement methods were implemented, and focus groups and interviews were conducted. All responses have been collected into 6 outcomes: basic needs met, strengthened personal resources, connection to others, built knowledge, skills and opportunity, connection to place and community, and contribution to the community. The stretch element of each accommodates the possible range from a foundation to a growth level. So in the case of contribution to the community, somebody after engaging with Bromley by Bow may feel motivated. Equally, they may be helping others after engaging with Bromley by Bow, and both are valid outcomes. This slide sets out the outcome domains, illustrating what each covers. These are the 12 domains into which the 6 stretch outcomes have been operationalised through the next stage of research I'll come on to. And as you can see, in every case except for basic needs met, the foundation growth element has been captured. We've also introduced an overarching wellbeing outcome and a means to capture any other change. And these have been all of these together combined have been turned into 40 indicators or questions through the next phase of the work, soon to become 41 indicators and questions. So to find out what change really looks like and an approach that works, we've consulted with internal and external colleagues, conducted a service delivery audit, reviewed more than 20 non-Bromley by Bow validated and non-validated tools, and crucially, we consulted with the very experienced external advisory group that this project works to, and the internal advisors across Bromley by Bow Centre and Health, a number of whom are present today and will be present in the breakout groups later on. For the 100-day challenge, over approximately 100 days, Bromley by Bow conducted in-depth discussions with 12 groups of staff that covered all 40 projects, essentially asking, what does realistic and achievable change look like for clients? All answers were grouped and mapped to a range of internal and external tools in order to turn these into indicators, the answers into indicators, and where a pre-existing tool question works, we've used it, and where not, we've developed a new question. The result is a tool designed to be used for every client to capture change as a direct result of Bromley by Bow's engagement. It's made of bespoke and validated indicators with 14 domains, 36 subjective indicators asked at the close of an intervention, and a hybrid of ONS4 and the personal wellbeing score, which itself is a very slightly reduced version of ONS4. And this provides a pre and post measure of wellbeing. And we're also in the process of getting a micro license to ask one overarching pre and post wellbeing question. Bromley by Bow codes presenting need to intended stretch outcome where possible in order to monitor need against the outcomes framework. And crucially, we have built the data capture into already used systems and practices, so pre-existing methods of engagement conversations with clients. Whole organisation training is necessary, and to support this, we've developed supporting resources like logic model, outcome commentary, a user journey data map. Before I move on to the user journey data map, I'd like to share some of the results of the indicator selection with teams, just to give you an insight into the result of that piece of work. So the range so far amongst the different teams and different projects is up to 30. So we need to reduce those down, because anyone who's used to conducting research or engaging with people, you don't want to ask too many questions and burden people. Other than ONS4 and anything else, which I've taken out of this table, this shows the top 10 indicators that have been selected out of all the indicators that have been selected. So it's probably no surprise that I know how to get the support I need, I feel less lonely, my mental health has improved, are right at the top 3 indicators selected. So far, projects, new projects are constantly being introduced and delivered at Bromley by Bow. So the result of all this work is a community-informed pre and post survey embedded into existing systems. And this diagram illustrates how this works in practice. So focusing on data collection points, the diagram maps a client's linear journey from first being in touch with Bromley by Bow through to the close of an engagement. However, as you know, the linear journey is often not that usual. Clients may engage for one point only. They may skip points, moving from initial contact to registering from an activity, or engage in social prescribing and bypass an activity. Bromley by Bow's approach measures change after an intervention, and that includes just one conversation after an activity, and also after all social prescribing conversations. But we capture data at different stages. So we capture information at the beginning in order to capture service need. So what is the demand for our services within the community? We find out how many people, type of people are taking up what services. We map presenting need, as I already mentioned, and we capture wellbeing baseline at one conversation. So the first social prescribing conversation that somebody has with Bromley by Bow. But as I mentioned also, one social prescribing conversation is an intervention itself. So we also capture the outcome of that conversation. We capture information, data from clients when they first register into an activity, where we again get a measure of service need, and we also take a wellbeing baseline at that point. When the activity closes, we understand what the take-up has been, and we also capture outcomes. And then again, after the final social prescribing conversation, we also measure outcomes. We are almost at the end of a testing phase in Bromley by Bow. So we've been testing the questions in lots of different ways, in order to understand if the questions translate for all clients, are the questions understood consistently, and are any questions problematic, ultimately to identify what needs changing. Also to understand how practitioners can confidently build the questions into the approach, because that's incredibly important to make sure that the questions don't disrupt service delivery and the communication, the relationship that practitioners build up with clients. We've taken different approaches to this. Cognitive interviews, we've hired an independent researcher to provide that neutrality that's needed, and that work is almost complete. And also 2 teams of practitioners have been trialling the questions internally. Overall, we're pleased to say there's a positive response from clients. They're pleased to be asked their view and about their experience as a result of engaging with Bromley by Bow. In order to make the questions clear, we are finding that it's really important to express quite early on in the engagement what's in it for the clients. The timing of the questions is important, so not to go straight in with asking about whether or not someone feels anxious before getting to know the client. Some questions are proving to be problematic, and I understand this is not a problem that's exclusive to Bromley by Bow. So we are looking at 2 particular ONS4 questions that are causing us a bit of confusion with clients. The answer categories are artificial. We ask people to say to the extent to which they agree with particular statements, and there are numbers attached to those. So as you know, that's not conversational, so that also needs to be explaining from the start. Because of the nature of some of the questions, well, one, overall, a training plan is needed, and that's something that we're developing in order to enable rollout across the whole of Bromley by Bow. Also, this is needed alongside some strong safeguarding training. Some of the questions, particularly the ONS4 questions, can be quite triggering, so that's something that we are developing internally. Refusals are to be respected, so no client is under any obligation to answer any questions. Expressing the importance and why their view matters is important at the start, but of course everyone has the opportunity to say no. So this is where we've got to. Before June last year, we developed the framework and we started to test mapping need to intended outcome. We conducted a scoping exercise until approximately September last year. Between October and March this year, we've been operationalising the framework with the 100-day challenge and the work that took place after that. We've been undertaking a data collection testing phase. And so what's next? We need to develop a whole organisation training and implementation plan and implement that, and also to expand the whole approach to non-English speakers, because at the moment it only accommodates English speakers, and that is a problem, a gap in our work that needs to be filled. Also, we need to develop a data use plan and to implement that. So what next for us? There are lots of things that we want to do. We want to be able to undertake a longitudinal study to be able to track clients over many years, because as Emma was saying, the relationship with Bromley by Bow, it's not episodic. We need to see what else happens, and also people engage in other services, not just in Bromley by Bow, with Bromley by Bow. We want to be able to establish contribution. We want to be able to develop a community level, community informed outcomes framework. And we want to be able to look at the patient-client flow between the community centre and the health partnership. And this is something that we're looking at the moment. So through anonymised data sharing, capturing outcome measurement consistently across both settings, and drawing on the other data that are available. So before we go into the breakout rooms, which is the next step, I just wanted to post this slide just to let you know, if you want to stay in touch with the work that we're doing, please do sign up to the newsletter, which is accessible via the link above. And now I'm going to hand over to Berenice, who's going to pass everybody into breakout rooms in order to understand a bit more from the practitioners at Bromley by Bow's perspective about the different stages of development and implementation that I've just run through.
Hi Berenice, is everybody back now?
Yes.
Yeah, great. Okay, well I hope you enjoyed your breakout sessions. It didn't feel like there was long enough. There's so much, isn't there, to go at in this you know, around this project. But what I'm going to do is go around the 5 breakout rooms, which really set out the sort of journey of Bromley by Bow, starting from the number 1, which is looking at the sort of development of the framework, to the testing, the 100-day challenge, and then the testing and the advisory group and so on. And just if I could ask somebody, the chair of that breakout room, to give us just a very quick headline findings from or headline sort of points that came up from your discussion. So we've got time for those questions coming through from Slido. So the first group was a development stage 1, developing the Bromley by Bow community informed outcomes framework. So that's Naomi, Dan and Mandy. I don't know who's going to give us a quick. Pracy?
Thank you, Jane. Yes, we talked through the development of the Unleashing Healthy Communities project, and I think it was really important to hear in more depth about the 3 strands: the historic research, the community research, and the work with practitioners to understand the model. And we had a couple of questions at the end, which I think were really important, about what we were measuring and what the 6 stretch outcomes were, and their sort of commonality across Bromley by Bow Health and Bromley by Bow Centre, the clinical and non-clinical work. One of the last questions that came up was really what have been the barriers, or what have been the important things in terms of getting this work going. And we talked, I think, quite a lot about taking it slowly, about getting significant levels of support, and I included yourself in that, Jane, actually, you know, getting expertise in, and we had an expert advisory group, of course, supporting the process as well. And then Mandy and Naomi talked particularly a lot around building trust, having that trust with the community and with practitioners about what this was all about. And I think at the end, Naomi made a really important point, which is focus on what's useful and what's practical. You know, if we're going to engage communities and practitioners in research and evaluation, it's really important that they're able to use that research and evaluation in their work, and so that it's meaningful for them and will be engaging for them. Thank you, Jane.
Yeah, thanks, Dan. Yeah, I recognise some of those sort of themes in the discussions. So there was a breakout room on the 100-day challenge. So this is around operationalising this outcomes framework into the systems and so on. And that's Layla, Mock and Jess. Is it Layla who's feeding back?
I'm happy to go and feedback. I also feel like we just got to the surface of much deeper conversations and discussions. So yeah, we laid out the 100-day challenge and going through indicator selections, and it was really interesting to hear from our group, who came from different backgrounds, some more in the social prescribing, some more in kind of youth work, about different challenges that they're facing. One of the questions that came up was how can an organisation that's perhaps got fewer resources or less external funding go through a process like ours to develop their own outcomes framework. Another question or a kind of point was that sometimes the kind of on the ground delivery teams have slightly different ideas of what the most important elements of their work are and how to balance that out. But like I said, lots more questions and conversations to be had.
Thanks, Jess. That's really, again, some kind of common themes coming out there in things. So the third group was question testing with clients and feedback. And as Catherine alluded to when she went through the presentation, there have been some really that's been a really interesting stage of the project, and there are definitely still some sort of challenges with that to make that work for the people you're going to ask questions of. And that's Catherine, Ruth and Emma. Is it you, Catherine, feeding back on that? Sorry, I've got that wrong. I apologise. That's Tamina, Shanaz, Hazina and Emily.
that's I'm happy to give a bit of a overview of what we discussed. So the general themes that that myself and the social welfare, so I'm a social prescriber, just to say, and then Hasina, Tamina and Shahnaz are on the social welfare advice team, just to give everyone a bit of a update. So we've been implementing the questions, and generally the themes that came through for both of our teams were that the challenges have been mostly about being a bit robotic when we're asking the questions, and how do we make sure that we are still maintaining that kind of level of a professional relationship and getting the trust there while still asking these questions. But we found that we've overcome that really by just wording the questions in more client appropriate ways, you know, where they're more likely to understand them, and then making them kind of work more naturally, flow naturally into the conversation. And when there's ever been hesitancy, we've obviously allowed the patient to have that and put NA in the questions or something like that. But mostly we found that, well, both of our teams could say that mostly there's been quite a positive response to the questions, and clients are quite pleasantly, you know, they're happy that we're taking the time to look into this and to make sure that we're providing really good services. So some of the questions that came up from the discussion was, how do we make sure, which were really good points to be fair, so we've had a good discussion around those. Obviously before, like I say, I think everyone could agree that we just touched the service of them. But some of the ones that came up is, how do we make sure that we're not kind of leading the questions by having to make this compromise of not asking them too directly, to make sure that we're still having a natural flowing conversation that engages the client and keeps their trust in that, which is a really good question. And I think we kind of just discussed how with some of the questions which need to be or would benefit mostly from being asked in a more direct way, like the ONS questions. For our social prescribing team, personally, we would be more direct with that and just kind of frame them of making the patient understand why we're asking and how it's important for them and for our team, so that we can make sure that we're having a positive effect on them, make sure that we're providing a good service. And usually, well, for example, personally for me, whenever I've explained that to a client, they're pretty happy about that and they understand why, and they're more than happy to go ahead with, you know, going through those questions kind of step by step, word for word. Another really interesting question, sorry, I forgot to write down who asked these questions, by the way, is how do we tell that it's our effects that we're having on that patient? So, you know, if before and end and at the end they're coming through as having that we've had a positive response and we've had a positive impact on their well-being, how can we make sure that it's actually our service that has had that effect? Which is really good, I think, discussion point just going forward. And I think it was Tamina who raised that, you know, it's in the future maybe, or at the post-intervention questions, which I don't think either of our teams have gone on to yet. It's about maybe, can we directly ask that patient, do you think it's our service that has had that direct effect? And I know some of the questions are worded as a direct result of being in this service, has this had an effect on XYZ? So yeah, really interesting questions, really interesting discussions.
It really gets down to the nitty gritty, doesn't it, of how you're actually going to do it and put it into a service. I think it's really useful. You could have a whole webinar on that.
Yeah, definitely.
Catherine, Ruth and Emma, the next one, which, sorry about putting the wrong people into that, I was misreading my line on the sheet, but using outcome data to inform service design.
Hello, yeah. So we had a discussion around, like you said, using data to inform service design, and that was very much around developing as a learning organisation, embedding co-production, and then using feedback and outcome measurement to design those services. And we gave very specific examples around our rapid response social prescribing, and how we were able to use data to redesign both services and team structure through the integrated health and wellbeing team, and then also some examples around the sort of the development of community advisory boards, looking at sort of governance within primary care. We didn't, like others, didn't have much time for questions, but two that we sort of discussed in a bit more detail was around co-production and just this feeling that residents don't necessarily always have the skills to take projects forward, and that it's costly to support. So we sort of looked at that around investing in residents just through our I guess experience, and around capacity building, community activation, participatory budgeting and training. And then we had a very specific sort of discussion around SNOMED coding of social outcomes within primary care. So that was obviously quite a sort of specific technical question. And I guess sort of one of the learnings there was just very much around the need to see the value of coding and why we're coding, and that SNOMED codes can be quite static, whilst it's sort of, we're working quite a dynamic, changing environment. So.
Thanks, Ruth. That's really two really interesting questions and points, I think, around co-production and then sort of coding. So, and the last but not least, the external perspective group, which was Marcello, David, Roxandra, and Marcello, are you going to feed back?
Yeah, I don't know, David. Did you want to because you made the notes? Maybe you want to.
It's quite all right.
Yeah. Okay.
Oh, sorry. I meant it's quite all right if you do.
Do you want me to do? Oh, sorry. Okay. Okay. So we talked about really acknowledging the kind of the realities of working in organization, both the funding and human resources, balancing the need to secure funding with also the need to develop these instruments that come from the community, from the bottom up. So it's like a marrying of bottom up and top down, if you like. And what does it mean for a program to work? David pointed out that right at the beginning, because what works depends on the perspective, and so it's important to acknowledge the perspective of different audiences, the community, the policymaker, the commissioners, and so on and so forth. But there is a lot of work there that has been done by Bromley by both to actually address all of this, and made several steps towards acknowledging all of this, and also the practical side of things. There was an acknowledgement. It takes time, a lot of time, and is about kind of almost like failing fast, so that if you fail quickly, so that you can pick up again and do better next time. And nobody said that actually, I just added it now, but anyway. And there was an interesting question towards the end about the use of patient records in evaluation. So we had a short discussion about how use of patient records might actually help with complementing what Bromley by Bow Centre is actually doing with all the community outcomes framework. And I'll stop there.
Yeah, thanks, Marcello. We're running out of time on this webinar, but I wonder if I can hand over to Catherine, because we have got some questions coming up. We're not going to be able to take all of these, but the questions coming up through Slido, and whether you'd like to.
Yes, I can do that. So we only got a couple of minutes, but one of the questions that's appeared in Slido is, areas are using asset-based community development as a key approach with activities done by the people rather than for or with. And I think the question is asking about Bromley by Bow's perspective on this. Jess, you're going to answer this question.
Yes, so relating back to the stretch outcomes, one of our stretch outcomes is having basic needs met, and lots of the services at the centre do that. For example, advice and social prescribing, and but we also have services, projects like the project I run, Communities Driving Change, which is all about bottom-up grassroots, supporting people to get involved in their community and to launch and run their own health and well-being projects. So I guess to answer that, it's a bit of both, really.
Thank you, Jess. One of the questions that's come up is how do we measure impact objectively? And I can provide a Bromley by Bow perspective on that, but one of the advisory group members might want to answer that question. David, Marcello?
Sorry, Catherine, I missed the problem with the line, I think. Would you mind answering posing the question again?
I'm sorry, I'm totally putting you on the spot, but how do we measure impact objectively? So that's not something that we do. We are capturing data, subjective measures of change from the perspective of our clients, as well as the ONS4 and Michael soon as well. So the question is, how do we capture, or how could we capture change impact objectively?
Well, I mean, it's a tough one. I would say objectively is difficult. I mean, quantitative research is comes from a tradition of more objective, if you like, in a sense that because you collect data on a large number of people, technically, you tend to be more objective on the actual change that has been made by the intervention. But the quantitative, it doesn't give you the whole picture because often these questions are short and just don't give much space for interpretation. So that's why a mix of quantitative and qualitative research are often quite important. So the qualitative research gives you that interpretation on what people's changes are actually about, and also it helps you to understand whether you actually missed asking the right question in the first place. Quantitative, which was one of the with example.
Thanks, Marcello. David, do you want to come in there briefly?
Only if there's time.
There's time for a brief reflection.
So I think this is a really important question. And the way I think about it is that we are unlikely to be able to measure the kind of impact that you're driving at. And so I think that's why it's important to have a program theory, because if you can develop a consensual program theory, then you can show that you've had effects on things on the pathway to that distal or longer term impact, and people will agree that they're valid indicators that you've made progress towards that impact.
Thank you, David. And I think, and Marcello, I think I'd add from Bromley by Bow's perspective that understanding the change that occurs from the perspective of our clients is the most important perspective that we want to be able to capture. So that is, from our point of view, the true change that we want to measure. I think that's all we've got time for in terms of questions, unfortunately. Jane, can I hand over to you?
Yeah, just to sort of wind up. And yeah, firstly to say, it can just a reminder from Berenice in, keep filling in your sort of evaluation, and there's some questions on Slido. So please do that. That would be really helpful. And I don't think will take sort of very long. But yeah, just to sort of sum up really, yet again, it's been a really brilliant webinar, and I'd particularly like to thank the sort of huge array of sort of contributors to this, who've given their sort of reflections from just so many different perspectives. And I think in summing up, I think having those different perspectives, people involved in service design, in funding, in research, in outcome measurement, in sort of service delivery, the social prescribing service and so on. We need all of those perspectives in, that's what I've heard, and all of that sort of time to develop those things to make an outcome framework really work. Just doing it in abstract is not going to work. And I suppose that's the second point of learning I've taken from it, is the need for just thinking about the time and support and trust that needs to be built over time as well to do this kind of work. So hopefully we have come to a shared understanding of just the time it takes to do that. And everybody, whatever point they are on that journey of developing their outcome measurement, hopefully this sharing of practice in Bromley by Bow will all help you. But I'd also like to thank not only Bromley by Bow for hosting this, but all the participants who've come and asked questions and taken part in the webinar. And if only we had a whole day to sort of learn from everybody's experience, because so many people are grappling with this. But just to finish, I'm going to finally hand over to Rob Trimble, as who's going to close the session on behalf of Bromley by Bow.
Thanks, Jane, and can I add my thanks to you for hosting this event for us, and also to Catherine, Berenice, and the whole team behind the scenes that have made this happen. I found this both a rich and enriching session. I hope you have too. I think I come away in some ways with the conclusion I often come away with from these sessions, that what we're doing isn't easy. And if it were easy, then someone would just show us how to do it. And I was really conscious the other day of one of my colleagues telling me that he'd been speaking to another organization in the kind of research field who'd said, could we have your stretch outcomes so we can copy them, and kind of missing the point that, of course, this is not a copy and paste exercise. There are methodologies, there's things underpinning the way that we're working, which hopefully will have some relevance and some resonance across lots of communities. But the process itself is absolutely critical in this, and for us to try and understand what matters to communities that we want to then measure, then of course we have to do the hard work. We have to dig into the communities. We have to stay for a long time. Bromley by Bow Centre itself has been around for 37 years. We need to build those relationships in order to be able to really understand what matters to communities. But I take that as an encouragement, and I just wanted, in joining Jane and thanking all of you for coming, I think the words that I heard quoted by one of our reportees from the breakout groups was from Naomi, and I think that kind of sums it up for me, which was the simple piece of advice to focus on what's useful and what's practical. And let's close there. So thank you all very much for coming.